complex movement I chose is a golf swing. Some examples of the movement types during a golf swing are the flexion of the arms, the extension of the arms, the extension of the legs, flexions of the legs, flexion of the head when it's looking down, rotation of the trunk, and flexion of the wrist. The muscles involved during a golf swing include rectus abdominis, external obliques, biceps brachii, triceps brachii, deltoids, pectoralis majors, trapezius, latissimus dorsi, rectus femoris, and gluteus maximus. The origin of the biceps brachii is the scapula of the shoulder girdle. The insertion is the proximal radius and the action is flexes the elbow. The origin of the deltoid is the scapular spine and clavicle. The insertion is the humerus and the action is the abducts the humerus. The origin of the pectoralis major is the sternum and clavicle. The insertion is the temporal bone and the action adducts and flexes the humerus. The origin of the rectus abdominis is the pubis and the insertion of the rectus abdominis is the sternum and 5th to 7th ribs. The action flexes the vertebral column. The origin of the trapezius is the occipital bone and all cervical and thoracic vertebrae. The insertion is the scapular spine and clavicle, and the action extends the neck and adducts the scapula. The origin of the external oblique is the lower 8 ribs. The insertion is the iliac crest, and the action flexes and rotates the vertebral column. The origin of the latissimus dorsi is the lower spine and the iliac crest. The insertion is the proximal humerus, and the action extends and adducts the humerus. The origin of the triceps brachii is the shoulder girdle and the proximal humerus. The insertion is the ulcrayon process of ulna. The action extends the elbow. The origin of the rectus femoris is the pelvis, and the insertion is the tibial tuberosity via patellar ligament. The action extends the knee and flexes the hip on the thigh. The origin of the gluteus maximus is the sacrum and ilium. The insertion is the proximal femur, and the action extends the hip. The bones and joints involved in a golf swing include the humerus, the ulna, the radius, the elbow, the clavicle, the shoulder girdle, the sternum, the pubis, the temporal bone, the vertebral column, the true and false ribs, the femur, the knees, the wrist, and the carpals. Some movements involved in a golf swing include the flexion of the elbow. The prime mover is the biceps brachii, and the antagonist is the triceps brachii. The synergist is the deltoids and pectoralis. Another movement is the extension of the elbow. The prime mover is the triceps brachii. The antagonist is the biceps brachii. The synergist is the deltoids and the pectoralis. Another movement is the flexion of the knee. The prime mover is the quadriceps. The antagonist is the hamstrings, and the synergist is the rectus femoris and gluteus maximus. Another movement is the extension of the knee. The prime mover is the hamstrings. The antagonist is the quadriceps, and the synergist is the rectus femoris and gastrocnemius. Another movement is the rotation of the trunk. The prime mover is the external obliques, the antagonist is the latissimus dorsi, and the synergist is the rectus abdominis.